Hey, everyone.
I'm in a meeting. Somehow my computer is not recognizing my flash drive. So I'll just speak without slides if I don't get it up in a moment. Sorry. Okay, I did get it. Okay. All right. Okay, now. So after the housekeeping, then you will stop sharing and I will share my slides. Is that the way?
Yes.
Okay, that's fine. Okay, we can start anytime.
Hi, everyone. This is Rachel, the project coordinator for our Early Psychosis Learning Collaborative. Please feel free to introduce yourself in the chat box. And now I just wanted to review a few housekeeping items with you all before we begin. Participant microphones have been muted at entry and you'll be able to mute them during the discussion portion. During the presentation, if you have any technical difficulties or questions about the topic, please use the chat box. And this webinar is being recorded and will be available for viewing at a later time on the MHTTC website. And to reach us after the webinar, you can email newengland@mhttcnetwork.org. Next slide, please. And this slide here shows our disclaimers. Next slide, please. And the MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, and consistent with our actions, policies, and products. And with that, it is my pleasure to hand it over to Dr. Macheri Keshwan for introductions.
Okay, thank you very much, Rachel, and good morning, everyone. Let me try sharing my slides. Have you stopped sharing yours? Okay. Okay, so let's see. Yeah, so it's my pleasure to open the second session in our series by the Mental Health Technical Transfer Center, MHTTC, which is focused on wellness, especially with an emphasis on those in the front lines like healthcare workers and first responders. I assume that everyone is able to see my slides. Rachel, tell me.
Yes, we can see it, sir.
Yeah, okay, very good. I'll try to put it on slideshow so people can see it even better. Okay, wonderful. So the one thing that I want to start off with by way of quick background is that health is always a balance. We go through life between being exposed to a multitude of risk factors, but also protective factors. And this is like a balance which stands on our own inner core strengths and abilities to deal with stress, which is what you might call resilience. Now, how does this balance come off, especially when we are talking about the current pandemic era, where there are multiple risk factors that are weighing over everyone in this world? It's a global stress that all of us are going through, some more than the others. And certainly, in the US, there may be a settling down of the pandemic, but countries like India, things are really still not settled down. The major risk factors in this context that we all face is at multiple levels, in terms of our health, medical illnesses, in terms of our employment, burnout, job loss, education, schools, sleeplessness, social distancing, social isolation, loneliness, fear, misinformation, stigma, and of course, race and disparities in care, which has particularly become more amplified in this context. All of this increase risk, and in the absence of protective factors, weigh against health and lead to various health difficulties. Now, what is it that can protect against this kind of an imbalance? There are many things that we know that could reduce risk in the current day and age. Vaccines, of course, social distancing, hygiene measures like hand washing, limiting over information, and so on. And also ways to enhance our protective factors like integrated biopsychosocial care, exercise, sleep hygiene, enhancing social connectedness, and so on. So we can reset the balance by reducing risk and enhancing protective factors. But there is one other very important aspect of bringing a balance back to our lives, and that is to shift the resilience itself to handle stress in a way that even if the stress is high, we can manage to be resilient and protected. And that is where techniques that are age-old, that we have known for thousands of years, such as yoga, come into play of how we can build our resilience. And these include yoga, as you will hear today, could be defined narrowly as a set of postures, but yoga is a comprehensive set of lifestyle practices that include mindfulness, acceptance, engagement, breathing, synchronization, and so forth. So this is what you're going to hear. And in this series that we will be bringing to you over the next several months, this is the second one of those. Myself and Raquel Misholam Gately, who is on this call, and Rachel Hegde, who you just heard, we are taking charge of this series of sessions, which involves several aspects of building resilience. The one that we are going to bring today to you is on yoga by what you might call the world's experts on yoga, which include Hemant Bhargav, Shriram Varambali, and P.N. Gangadhar. And of course, in subsequent sessions, we will be bringing to you techniques of mindfulness, sleep hygiene, enhancing positivity, music and wellness, and art and wellness, and spirituality, and so forth. Very briefly, the three speakers of today, the three teachers, are all from the National Institute of Mental Health and Neurosciences in Bangalore. I'm proud to say that I trained in this esteemed institution over 40 years ago in Bangalore, which is really has become the premier center for developing evidence-based approaches to building resilience using yoga and similar techniques. So with that, I will close my opening remarks and open it up for our speakers, Dr. Varambali and Bhargav and Gangadhar. So I'll stop sharing my slides. And okay. Hemant, take it away.
My namaste to all of you. My mentor, Dr. Shriram Varambali, is here, who is the head of the Department of Integrative Medicine at NIMHANS. And I would request Shriram sir to begin the proceedings.
Thanks, Hemant. Thanks a lot, Dr. Keshavan. I really want to thank the team at the MHTTC and the SAMHSA who have brought us all together here. Rachel, Vanessa, Raquel, and as Dr. Keshavan said, the COVID-19 pandemic has really shown us that the world is a very small place, and what can happen in America can happen in India or in Africa, wherever it is, and there is no place right now which is has been able to escape completely from the COVID pandemic. And even otherwise, this is something that we need to learn that, really speaking, we are all in this together, whether we like it or not. And each country or a culture has its own way of handling stress. And as I'll go on to show on in my little later, maybe in my talk, we would actually, look at stress in a very different way. The modern word stress in the modern literature or in the minds of the public has taken on a very negative connotation, but actually it is not negative. It's just a way that organisms or people adapt to a situation. It need not be negative. When you say I'm stressed, most people mean it very negatively, that I am under a lot of pressure, but actually it is not the real meaning of the word, as I'll go on to explain later. We also think that this is a time for which, in the last 50 years, maybe we've had the best life possible. We are one of the generations who have not really seen the difficulties that our parents and their grandparents saw in terms of world wars and famine and drought and things like that. We have fairly self-sufficient in terms of at least food for the majority of the countries. There are, of course, some countries who are still struggling, but in terms of the global food and other things, we have been very fortunate. So when we are faced with this kind of a difficulty, maybe it looks, quite difficult, but this is nothing compared to what our parents and grandparents went through in terms of uncertainty. I am reminded of a lecture by Dr. Dilip Jeste, who was the former president of the American Psychiatric Association a few years back. He had come down here and talked about why cultures around the world have a lot of respect for elders. This is across cultures. This is in fact across the animal world. Even in a herd of elephants or other animals, there is a lot of respect for elders, not just because they have brought us up, but because of something that we call as wisdom. Now, what is wisdom? It is not just knowledge. It is the ability to apply it in a given situation, and that only comes from experience. And adversity is a great teacher. So we have to learn from adversity, anti-fragile, if you want to call it, like Taleb says, Nicholas Nassim Taleb, who has written a book called Anti-Fragile, how to be anti-fragile, how to actually handle stress and come out as a stronger person. So that's something that we need to actually learn if we are to become wise. Anybody can be knowledgeable. You read a book and you get knowledge. But can you be wise just by reading? You need to experience things and then to, become a better person. That's whatever is in your capacity. In a sense, we are all lucky to be here today, even after the COVID pandemic, as we have, the number of deaths we have seen in the COVID pandemic is unprecedented for the modern times. And we, of course, are lucky. But how do we use this luck? How do we become better people to help other people is something that we want to look at. We also think, we probably want your feedback on what you have been going through, maybe in the last 1 year, in the last 1 week. So we have a set of questions. I think there is a way that we can ask you those questions and get your response. I think maybe Rachel or Vanessa can help us with that. Can we do that? We have the questions, Hemant.
Vanessa, yeah, okay.
Yeah, there you are. Okay. I hope all of you are able to see it on your screens, and hopefully you let us know what you feel. Okay, the process has started, it looks like. Okay, this is good.
Shivaram, you're able to see the responses?
Yeah, I think I can see. Yes.
Okay, yeah, so
We are all, I think we are close to 70% already. Okay. Yeah, I think we have got close to 70%. Okay. Still, yeah, people are still voting.
but you get the general picture, so you could.
Yeah, yes, I think we
Go
have
ahead.
got enough information here. All right, let me just look through. Okay. Right. So this looks like we have got very good information. Of course, the answer to the first question seems to be very unanimous. It's 100% that in the last 1 year, everybody has gone through a very, very stressful situation. It's no surprise. And the second question is again informative, that in the last 1 week, maybe in the US, things have got better. But as Dr. Keshavan said, if you go around other parts of the world, the same situation is still continuing. In India, I think in the last couple of weeks, things are slightly better, but we are still not out of the woods. So the stress, as I was saying, what happens is fairly universal across countries, across cultures. But if you look at how people handle it, there would be a tremendous difference in the way that people handle it. Of course, the more fortunate in terms of either healthcare facilities, money, would be in a better position to handle. But even there, you can see differences among people. And that's what we are going to talk about today. And what I'm seeing here is that in a sense, we might already be preaching to the converted, because I can see close to 40% people have tried yoga or meditation. Some people have tried exercise to cope with this stress, and some people have already maybe handled it in a very good way, and therefore the last 1 week the answer may be very different from the past 1 year. So that's very good. I mean, people will find their own ways of doing it. So what we will do now is that Hemant, who you all just saw before I spoke, he is in a sense quite a unique skill set. He has a unique skill set. He is a medical doctor. It's called MBBS in India. So it's a 5.5-year course. But after that, he decided to switch to yoga full time, and he did a master's, which is called an MD in yoga and rehabilitation. And he also did a PhD later in yoga in a university called as the SVyasa, which is a university of yoga located in Bangalore. So he he's a medical person, but also has great knowledge of yoga. And probably what he's going to do now is take us through a short, very, very short session of a yoga module, which we have been using primarily during the COVID pandemic in India and actually across the world. In fact, we did actually receive a request from the Indian Association of Greater Boston somewhere in the third trimester of last year. And then we started a 6-month, we ran it for 6 months. We ran a series of yoga, tele-yoga actually, for these people who are members of that association. Hemant and Nishita from our center ran it almost for 6 months, isn't it, Hemant?
Yes, sir.
And in fact, we published a recent article in the Asian Journal of Psychiatry on what tele-yoga was able to do for these people who joined us from across the world. So Hemant is going to give us a brief demo now. I hope all of you, this is not, you don't need to really, it's not a very difficult thing to do. You can be sitting on your chair, or if you have a mat, even better, but it can be done anywhere. It doesn't involve very complex positions. So it just give us a taste of what yoga can do for people with stress. This is part of a module that we have developed here for people in their working environment. It might be, a healthcare, it might be a hospital, it might be a bank, it might be a police station. So he has developed a set of modules which we can teach to people in their place of work. So he's going to give us a demo. Hemant, you can take over now.
Thank you. Thank you, sir. I'll share my slides.
Go ahead.
I hope my slides are visible.
Yeah, now it is, Hemant.
Thank you very much to BIMDC. I am really grateful to Keshavan sir and the team for giving me this opportunity. Before we go into actually the practice of yoga, it is important that we understand the underlying philosophical basis on which these practices have been developed. I have seen in the chat box that there are many psychologists, psychiatrists, social workers, and even yoga therapists who have joined this session. So I think these are going to be very interesting sessions. Now, the picture on your slide is actually a 5-layer of existence model that comes from a Vedic scripture known as Taittiriya Upanishad. This particular scripture, unlike the modern understanding that the existence is basically physical, mental, and social, this particular text divides the human existence into these 5 layers. The first layer is called as the physical layer, which we all know and understand through science, the layer going right up to the cellular and genetic changes. Then the second layer is the layer of life force, which we can understand through the physiological processes in the body. So this particular layer governs the physiology, the functional aspect. The third layer is the layer of emotions. This particular layer, according to the text, is characterized by emotionally charged thoughts, which have a pattern of repeating themselves. These thoughts cannot come to any conclusion, but they keep dwelling from one side to another side. Then the deeper aspect of the mind is the fourth layer. This layer has a more streamlined flow of thoughts. There is a clarity, there is an insight into the issue, and a power of discriminating between what is to be done and what is not to be done. So they are more clearer thoughts. And then the core of the existence that the text describes is the bliss, the ananda in the Sanskrit language. Now, it is interesting that the text, Vedic text goes further and tells us the yogic understanding of how the diseases on the body are developed. It says that any illness manifesting at the physical level has two origins. One is external. The example can be disorders caused due to infection, accidents, injuries, or poisoning. Whereas the second classification is the disorders caused due to an internal cause. Now, the text says that the internal here is not only limited to the physical layer. In modern understanding, we can go up to the genetics or epigenetics. But the text says that it is further deeper into the second layer and then into the third layer. In fact, the third layer, the layer of emotions, is considered as the root cause for the disorders where you cannot find any obvious external cause. How these disorders start at the third layer is through a repeated patterns of emotionally charged thoughts. They are being called as chitta vrittis. And yoga is all about different techniques of using body, breath, and mind to pacify and calm down these layers of existence. The text says that the fourth and the fifth layer are by default perfect. And the job of yoga therapy is to harmonize the first three layers so that the physical layer gets in touch with the fourth and the fifth layer, and then the health is manifested by default. So with this background, we have developed the yoga capsules. The capsules focus on using asanas to balance the physical layer, pranayamas to balance the second layer of life force, and meditation and relaxation techniques to harmonize the third layer, the layer of emotions. So I will begin with the instructions that are to be followed while performing these practices. I would actually request and encourage all of you to do the practices with me, because that will give you the experience of how it feels when you actually do it. These capsules can be done every day. It is ideal to do it twice a day, 5 days a week. But our researchers show that minimum of 3 sessions per week are required to have sustained benefits. Then please do not overexert yourself. Perform the practices within your comfortable limits. These practices can be modified to be performed on a chair. It is ideal to do them on a mat, but I will also show you how they can be done on a chair. The fast breathing practices, especially, should be done only in an empty stomach condition, that is 2 hours after a meal or 1 hour after a snack. Wear a loose, comfortable dress while you are doing this practice. Perform the practice in a non-polluted, well-ventilated place. And the last but very important part of doing this practice is observing a calm, relaxed face throughout the practice. Macheri sir was actually talking about resilience building through yoga. And one of the mechanisms through which yoga does that is exposing the system voluntarily into a mild stressful condition. Say you maintain a certain pose for a long time, or you hold your breath for a certain time, and then maintain a calm, relaxed, gentle face at the same time. This will give a feedback to our nervous system to remain calm during adversities. So this is how yoga can teach us resilience. Now let us get ready for the practice. First, I will begin with a yoga capsule for stress. In fact, in the poll, we saw that anxiety was the most commonly reported symptom, which people have said 74%. So stress and anxiety will be our target today. And then the next frequent condition was sleep. And then that is 69%. And then 52% of the people reported low mood. So therefore, I have decided to focus on 4 brief yoga capsules: stress, anxiety, depression, and sleep. So let us begin with the yoga capsule for stress. As you will see that in my capsules, there are 1 or 2 minutes techniques. They start with the physical component, then go to the breath component, and then finally come to the mind component, the first 3 layers and their harmony. So I request all of you to prepare yourself for the yoga practice. I will also go and sit on my mat. In fact, my first practice is a standing practice. So this particular module will begin with the physical practice. Next slide. The first practice is known as Tadasana stretch or palm tree pose. I request all of you to come to standing position. Bring your feet in line with your shoulders, hands by the side of your thighs. Now interlock your fingers, keep them on the chest. Take a deep breath in and stretch up your hands above your head. And now fix your gaze straight at a point in front of you. Take another deep breath in and come up on your toes. Stretch your whole body up and maintain this without holding your breath for 5 counts. 1, 2, 3, 4, and 5. Breathe out and gently release and relax. Feel your heartbeat. Observe your breath. Now spread your legs 2 feet apart. Once again, interlock your fingers, keep them on the chest. Take a deep breath in, stretch your hands above your head. Breathe out. Take another deep breath in. And as you breathe out, gently bend towards the right side. Close your eyes and feel the stretch on the left side of the body. Breathe in, come to center. Breathe out and go to the other side. Breathe in, come to center. Breathe out. Breathe in. Breathe out. One more round. Take a deep breath in. Breathe out. Breathe in and breathe out. Now breathe in and come to center. Release your hands and relax. Close your eyes. Relax your shoulders. Keep a gentle smile on the face. Just become aware of your heartbeat and breath. Next practice is an asana. The difference between the warm-up practice and asana is that the asana is maintained a little longer. Sthiram Sukham Asanam. So the final pose, maintain it comfortably. I will give a quick demonstration of this practice before we do it together. So you have to get your feet together, raise your hand above your head, bend to the other side, then come to center, and then bring your hands down like this. This we will do on the other side as well. Get ready. Feet together, hands by the side of your thighs. Fix your gaze at a point straight in front of you. Now we have to raise the right hand sideways. Please keep your awareness on the tip of your fingers of the right hand. Start breathing in. Take your hand sideways. Bring it little up. Come up to 90 degrees. Breathe out. Gently turn the palm upwards. Again, start breathing in. Take your hands straight up above your head till your biceps touch your ears. Breathe out. Take a deep breath in and stretch the whole right half of the body up. And as you breathe out, glide your left hand along your thighs and then bend towards the left side. Now in this posture, close your eyes. Do not hold your breath. Bring your attention to the stretch that you can feel on the right half of your body. 1, 2, 3, 4, and 5. Breathe in, come to center. Now take another deep breath in, stretch the right side up. Breathe out and start taking your hand down. Feel a gentle tingling sensation around your fingers. Come up to 90 degree. Breathe in, turn your palm down. Breathe out and come down. Relax. Bring your legs in line with your shoulders. Close your eyes. Now compare the right half and the left half of your body. You may be able to feel that the right half feels lighter than the left half. Now to balance, let us do the practice on the other side. Feet together. As you breathe in, gently start raising your left hand sideways upwards. Come up to 90 degree. Breathe out, turn it up. Again, start breathing in. Straight up. Breathe out. Breathe in and stretch the left side of the body up. And then as you breathe out, bend towards the right side, gently gliding your right hand along your thigh. Close your eyes. Gentle smile on the face. Relax in this posture. 1, 2, 3, 4, and 5. Breathe in, come to center. Breathe out. Take another deep breath in, stretch up. And then as you breathe out, start bringing your left hand down. Feel a tingling sensation around the left fingertips. Come up to the 90 degree. Breathe in, turn it down. Breathe out. Bring the hand down. Release and relax. Close your eyes. Feel now that both right and the left half of your body have balanced. Slowly open your eyes. Get ready for the next practice. Next practice is called as instant relaxation technique. In fact, this technique can be used at the workplace very easily and very instantly. It brings relaxation into the whole body. So this technique can be done in a lying down position or on a chair. Let us do it in a lying down position first, and then I will show you how to do it on a chair. So come to a lying down position. Legs apart, hands apart, palms facing the roof. This particular practice focuses on tightening your body parts quickly from your toes up to your head. Get ready. Bring your legs together. Hands by the side of your thighs. Close your eyes. Bend your toes and tighten them. Tighten your ankle joints. Tighten your calf muscles. Pull up your kneecaps. Tighten your thighs. Squeeze your buttocks. Make a fist and tighten your hands. Tighten your arms and shoulders. Take a deep breath in and tighten your chest. Tighten your abdomen. Tighten your back. Clench your teeth and squeeze your eyes. Tighten the whole face. Tighten the whole body. Tighten, tighten, tighten. Release and relax. Open your palms, legs apart, palms facing the roof. Observe your breath. Feel the enhanced microcirculation throughout your body. Surrender your whole body weight to the ground. Now, let us do the same practice on a chair. Ideally, 2 rounds of this practice should be done. So let us do the chair variation. On the chair, you have to stretch your legs forward, interlock your fingers, and drop your neck back. Stretch your hands above your head like this. Now the same instructions. First come to this position, close your eyes, bend your toes and tighten them, tighten your ankle joints, calf muscles, pull up your kneecaps, tighten your thighs, squeeze your buttocks, tighten your arms, take a deep breath in and tighten your chest, abdomen, tighten your back, tighten your face by clenching the teeth and squeezing the eyes, tighten your whole body, tighten, 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 release and relax. Palms facing up, neck loose and relaxed. Relax your shoulders. Feel your heartbeat. Keep a gentle smile on the face. For 1 minute, allow the system to come back to the normalcy. Get ready for the next practice for stress reduction. This particular practice is called as the Antar Kumbhaka with Mukha Dhauti. Sit comfortably. You can sit on a chair, keeping both the feet firmly on the ground, or you can sit in cross-leg posture on the ground. I will give a quick demonstration before we do it together. In this practice, first we shall do 3 rounds of Mukha Dhauti. It means forceful exhalation of the breath from the mouth. You have to hold the shoulders like this, the knee joints like this. Keep the shoulders relaxed. Take a deep breath in through the nose and then breathe out from the mouth like this. We shall do this 3 times, and then as soon as we do the practice for the 3rd time, we shall perform a deep inhalation, completely filling the air with the lungs with the air, and then touching the chin to the chest and performing a chin lock. Then the breath should be retained inside as far as possible within your comfortable limit. I will count up to 30, but if you feel that you cannot retain it more than say 15 or 20, you can release it. If you feel that you can extend a little longer, you can do that, but within your comfortable limits. Also, it is important that after the chin lock, when you have to release it, first come up, raise your neck up, and then breathe out. Okay, let's get ready. Cross-leg position, hands on the knee. Mukha Dhauti, forceful exhalation 3 times. Take a deep breath in through the nostrils. Breathe out. Once again, breathe in. Breathe out. Another round. Breathe in. Breathe out. Now breathe in fully. Chin lock. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Slowly look up and then breathe out. Keep a gentle smile on the face, body relaxed. Feel the increase in the heartbeat, increase in the respiratory rate. Allow the breath to settle down naturally. These are mild, stressful situations where we should learn to keep a smiling face. Now, after preparing the body and the breath, we are ready to balance the second layer through alternate nostril breathing. Chin Mudra with the left hand palm facing up. So you are touching your index finger to the thumb, other three fingers are straight. This faces up. Then Nasika Mudra with the right hand, bending the index finger and the middle finger. You are using the ring finger and the thumb of the right hand to change your nostrils. Take a deep breath in and hold your breath. Gently close the right nostril with the right thumb and breathe out from the left. Breathe in from the left. Change and breathe out from the right. Breathe in from the right. Change and breathe out from the left. This is one cycle. Continue on your own for 4 more cycles. While doing this practice, please keep your attention on the touch of the air in your nostrils. Keep the neck steady. Do not move your face forward or backward. Avoid any jerky inhalation or exhalation. A very gentle, smooth flow of the air into the nostrils. Now, in the last rounds, try to make the practice as slow as possible. Make it your last cycle. Relax. Feel the balance between the right and the left nostrils in the airflow. Feel the calmness in the mind. Now, the last practice in this capsule is the humming breath, producing the gentle sound vibrations into the face and the brain. The internal massaging effect of the organs can be felt with this practice. In fact, recent research has shown that this practice can reduce blood pressure and enhance nitric oxide levels. So let us get ready. For this practice, close your ears with your respective thumbs, pressing on the tragus, the cartilage, and then the other 4 fingers of the hand can press on the orbital bone and close the eyes, cover the eyes. Make sure that you are not pressing on the eyes. In this position, Touch your tongue gently to the upper palate. And now produce the humming sound for 6 rounds. Feel the vibration in your face and head. Take a deep breath in. Focus on the vibrations, 3 more rounds. Last round. Gently drop down your hands and sit relaxed. Feel the relaxation in your body, gentleness and rhythm in your breath, calmness in the mind. Very gently open your eyes. Thank you very much. Over to you, Shivram sir.
Thanks, Hemant. I hope all of you got a taste of what we mean by yoga for stress. And as you can see, it's not a very complicated practice at all. Okay, I think you can stop sharing, Hemant. Yeah, okay. So since we have got a practical demonstration of what we mean, I will use the next maybe 15 to 17 minutes to just talk about why we think yoga could help produce the changes that we want to see in ourselves. This is a little bit of research from our own center, a little bit of knowledge we have got from various sources all around the world. So I'm just going to try and share my slide now. Okay. Okay, can you see my side, Hemant?
Yes, sir. Yes, sir.
Okay. So I basically head the Department of Integrative Medicine at NIMHANS, of which Hemant is one of the faculty. And we have a combination of modern psychiatrists here, yoga professionals, as well as professionals from a field of Ayurveda, which is the ancient Indian system of medicine. So that comprises the Department of Integrative Medicine here, which is the first national institute in India to have such a department, although some other institutes in India have had it for a long time. We feel that this is the right time to begin this kind of departments where we all can work together. What I'm basically going to focus on in the next 15 minutes is what we all want to have, what we should have, what is positive mental health. It's not just not being distressed. We should be happy, we should feel well, we should feel satisfied. These are answers given by people like you when we asked the questions to you today. When we did surveys, this is the answers we got when people say what they mean by positive mental health. They should find meaning in life and they should be able to achieve their full personal potential. But when we look at how and why, we call this as a 6 friends of knowledge, what, why, how, when, who. So that I use these 6 friends of knowledge to try and answer these questions. Why is it important? COVID-19 has made us all realize that, mental state has a terrific impact on physical health and immunity, and vice versa as well. And as you can see, one quotation from, a very old source from Epictetus himself, saying that men are troubled not by things, but how they see them. And a more recent from the granddaddy of stress, Hans Selye, who said, stress is not what happens to you, but how you react to it. In his famous book called Stress Without Distress in 1974, Hans Selye, as you may all have heard, is the person who gave us the general adaptation syndrome and talked about what stress means and how we can deal with it. This is the famous Hebbian version of the Yerkes and Dodson law, which basically talks about the relationship between pressure and performance. So till a certain point of time, we all need some stress. If I don't have an exam or any exit from a course, most likely I would not give much attention to it. I wouldn't study. So we need a certain level of pressure. But when the pressure crosses the curve and goes over the other side, our performance starts becoming worse because of the anxiety. So this is a very famous explanation for why we do well when we are under a certain amount of stress, what Selye referred to as EU stress. Whereas when we cross over to the other side, it becomes distress, which is a problem. So who can achieve positive mental health and when? Children seem to have a natural reservoir of, happiness. They can be happy in a, any situation, as you would have seen in movies like, I think it's called A Beautiful Life, where in a war situation, the child is be able to be happy provided some kind of safety. So it seems easy for children, but can adults have it? Some people think, it's good, retired people, they have no more tension in life, they can be, happy, but, it may not work out that way. And where do we find it? Do we find it at home, in the school, college, or office? Some people may find it in sports or, creative pursuits like music, drawing, painting, or some people, of course, many of us may be trying to find it in a restaurant or a bar, looking at alcohol or food. But the important question is, how do we achieve this positive mental health? I'm sure all of you would have heard this gentleman, or at least heard of him. He is famous for two things. One is what he is, this theory of positive psychology and flow. And of course, he's also famous for his almost unpronounceable second name, which is apparently pronounced as Csikszentmihalyi. So I won't try it again. So this is a very famous book that he wrote in 1990 called as Flow, the Psychology of Optimal Experience, and where he describes a state which he calls as flow, where people are so involved in an activity that nothing else seems to matter. They forget themselves. In common language, we call this person is in the zone today, he's in the group today. But the idea is that the person is immersed in what he's doing for its own sake. He's not worried about whether he's going to get money for it, whether something else is going to happen. He's involved in the activity for its own sake. And this optimal experience, where there is a merging of action and awareness, requires two things. One, it requires a challenge. It doesn't happen when there is nothing challenging. You get bored. You're sitting in a class, maybe you're bored when I'm talking here because it's not challenging for you. Maybe it's challenging for me. But you also have to have skill to match that challenge. When skills and challenge are equally or evenly matched, then usually a flow state can occur. And very surprisingly, if you look at where he has done extensive research on this, and he says it's most commonly reported, as you would expect, in sports arena, in the creative arts, and actually the third place where it is highest, chance is at work. Hopefully we are in a work that we like, where it can happen. And in his book, he says yoga is one of the oldest and most systematic methods of producing this flow experience. And he says we haven't really come up with another method as good at it till now. So here I've given some examples. I am a big fan of Roger Federer. Sachin Tendulkar is the cricketer, you can see. Lata Mangeshkar is a very famous singer, the national icon of Indian art or creativity. And the other photo is myself and Dr. Gangadhar meeting the Dalai Lama, who is one of the people I can say in my life. Of course, I only met one Nobel winner. But when you meet him, you realize how you can live with joy. He's like a child. He just makes you aware that even with all the difficulties around, how you can live with compassion and joy. He's a real example of a person who possibly has achieved that flow state and is able to maintain that. So these are just examples that I'm giving. But this is one important thing that I want to bring to your notice, is that when we are hungry, we eat. We get what we are call as pleasure, or we get something we really wanted. But what is enjoyment? Enjoyment occurs when your skill you match to a challenge and you meet the challenge. Pleasure only leads to a contentment. I'm happy, I've eaten well, I feel content, but nothing else happens. Whereas if you enjoy, you change yourself and grow, and this is what really needs to happen. So these are some examples of people who have possibly achieved this state. The person on the left, the first person, is the famous yoga guru B.K. Iyengar, who was the leader of yoga for a long time. A few years back, he passed away at the age of 94. The person in the middle is a very famous cricketer in India, who in the midst of all the sport has remained an icon for his behavior. And the book actually says the nice guy who finished first. And the person on the extreme right is our former president, Dr. Abdul Kalam, who was a leader and an example for all of India on how to, he passed away while teaching a class that he wanted to. He just, passed away on the stage. Until that point of time, he was completely well and, a real example for all of us. But how do we train the brain to achieve this kind of a state? In the past, when we were all medical students, we were taught that the brain is a fairly static organ, and once something is damaged, it doesn't really recover. Unlike, say, your skin, for example, if you cut your skin, you're fairly sure that in a couple of days, it will be okay. But then the brain is not like that. That's what we were taught. But now we know that's not really the case. The brain has a tremendous ability to functionally change the part of the brain that is doing a certain job. If a certain part gets damaged, some other part can take over that job. And many times, otherwise nobody would, a stroke would ever recover. But people do recover. The second important part is, as Dr. Keshavan is one of the leading lights in the world in terms of research on brain circuits, and he will tell you that earlier we thought of brain areas, Broca's area for speech and this area for that. But now we know it's not just areas, it is circuits. There's certain circuits in the brain which are involved in all functions. There's a circuit for memory, there's a circuit for how we process emotion, there's a circuit for how we process visual cues. So there's a circuit for everything, and the circuit is very important, not just the brain area. Many times we compare our brain to a computer, but your computer is nowhere near the complexity of the human brain, not as yet. Maybe in 50 years from now it will be. One important point is that the computer cannot decide to switch a function from one part to the other. Maybe you can do it, you can replace a part in a computer, but the brain is capable of doing it automatically. This process we call as neuroplasticity, the ability of the brain to change what it does and possibly repair itself. And this plasticity came from the work. One of the important people who did this work was Donald Hebb, who was considered the father of neuropsychology and neural networks. In his famous book, Organization of Behavior in 1949, he said, this is called Hebb's law. Neurons that fire together, wire together, and neurons that are out of sync lose their link. And this is really the basis of our ability to rewire our brain's behaviors, even our moods and thoughts. There are many circuits in the brain, some of which require more training, some of which require very less training. For example, something called as implicit memory. I learned to walk, I never forget unless I have dementia or I have a head injury. I learned to ride a bicycle, I almost never forget it. I learned to swim, I never forget it. This is because the circuits which process these are very, very strong and deep rooted. And once it is learned, it's almost difficult to forget. Whereas the explicit memory, I meet somebody today, they tell me their name, maybe I don't remember it, we have to train it. And for these kinds of skills, practice makes perfect is really true. Say, for example, pilots, airline pilots have a 10,000 hour rule. So if you do something for 10,000 hours, then you are considered to be an expert and you can deal well in emergency situations. You would automatically do something. I hope some of you would have watched Novak Djokovic's match in the French Open a couple of days back, where he took on Tsitsipas in the final. And after 2 4-hour matches, at the end he was still resilient enough to actually do what he needed to do to finish the match. It's incredible simply because of the hours of practice that has gone in. So you don't even think, you simply do. And this is what Daniel Kahneman refers to as system 1 and system 2. System 1 is our immediate response, which may be not appropriate to the situation. We are not using our system 2, which is the thinking or the logical approach, unless we practice doing it every day. Now, how do we train the brain? There are various things, Yoga, when I say yoga, I always include meditation. There is no yoga without meditation. It's like physics without mathematics. You can't simply have it. All yoga is meditative. There are some other ways as well. People have showed that intermittent fasting, having novel experiences, learning a new skill, maybe guitar, maybe football, and involved reading. When you're reading something that makes you forget yourself, all these are excellent ways to train the brain, and in fact can cause what we call as neurogenesis, formation of new neurons in the brain, which we thought was a scientific impossibility a few years back. It's shown that actually it is possible. Coming to the second part of my brief presentation, I wouldn't talk much about the basis of yoga. Dr. Gangadhar in his talk, maybe a couple of days later on the 17th, we'll go into it, but I just want to introduce this one concept that the Bhagavad Gita, which is one of the epics in Indian culture, talks about equilibrium being yoga. And if you look at the poem If by Rudyard Kipling, it's very similar. If you can meet with triumph and disaster and treat these two impostors just the same, that's the real achievement of a human being. And of course, all of you would be aware that these are the highlighted ones here are the common things which people think when they think of yoga. You think of physical posture and you think of breathing. But Patanjali, who was the sage who codified yoga, talked about so many other things, starting from yama, niyama, which are rules, and then going on to the meditative and introspective practices. Even many people think yoga is just an exercise. Is it? It's not really true. Why? You can have so many physiological differences. And of course, as Dr. Gangadhar will show us on Thursday, we also have a lot of mental differences. This is one of the slides which I always use. Here is the famous B.K.S. Iyengar, doing a famous, yoga pose, using a prop. But another person, the person below, of course, the pose looks very similar, but I'm sure you will agree that the effects the next day morning are likely to be entirely different. So why I put this slide is how something is done is as important as what is done. The pose is not so important. As Hemant was trying to tell you, if something causes pain, that's not yoga. You should be able to do it comfortably, hold that position, and become meditative or relaxed in that position. That is yoga, not the pose itself. And as we all know, many people do yoga for physical effects, but if you really want mental effects, you have to do the yoga mindfully. And then you would get this, what Patanjali talks about, that it controls the oscillations of the mind and enables you to be in equilibrium, whatever the situation. Now, why are we talking about yoga today? It has been fairly well shown now that people who do yoga and meditation on a long-term basis, their brains do not atrophy at the same rate that otherwise it would happen. All of us know that our brains are becoming smaller as we age, but for people who do yoga, it does not seem to happen so rapidly. We did a study among elderly in Bangalore, people who are living in old age homes, and over 6 months of yoga, their memory actually got better. So these are, I'm not going to go into this slide in detail, but we have worked on people who have psychiatric disorders, depression, schizophrenia, cognitive impairment of the elderly, alcohol dependence, and we have seen not only reduction in symptoms, but some clues as to how this happens. For example, in depression, we have seen that there is a cortisol goes down, which is a stress hormone, and there is an increase in a neuroplastic marker called as the brain-derived neurotrophic factor, right? So in the elderly, actually, we have been able to show in a small sample, there's an actual increase in a area of the brain called as hippocampus, which is critical for memory. This is a wonderful thing for all of us. If it can happen in 60 to 70-year-old people, it should happen even better in us. How does it happen? Yoga is learned from a teacher, imitating the teacher, being mindful, and then synchronizing the breath and being relaxed except the posture. And all this, what happens is that, this is a study done by Professor Gangadhar's daughter when she was a medical student, a very simple chanting, what Hemant made you do, Brahmari or Om chanting. What happens is that the areas of the brain, the limbic system, which processes emotions, actually come down. The blood supply to those regions actually comes down. It's a simple, 10-minute chanting can make such significant changes in the brain. This is a very recent paper from Sarah Lazar and her group, who have been consistently showing differences in brain thickness, actual cortical thickness in people who are doing long-term yoga. This is a study on elderly female yoginis, they are called, or people who just been doing yoga for a very long time. And as you can see, the highlighted areas in the brain are actually thicker in these people as compared to people who are not. So basically, this is what I'm saying. It's not that this has suddenly come overnight, but atrophy is not happening in these people. In a small sample, like I said, we have actually been able to show that there is an increase in the area of gray matter called as hippocampus, like which I said is very critical for memory. This is a very small study. We're trying to replicate it now. But why are we talking about yoga again? When we are in a crisis, this is a very famous prayer called as a serenity prayer attributed to Niebuhr in 1943. But if you look at ancient Indian literature from Nalanda University, which was one of the mega universities in the 8th century, Shanti Deva says, if there is a remedy when trouble strikes, why should you be dejected? And if there is nothing to be done, why should you be glum? So this is, very, very similar to the serenity prayer. So coming to the end of my talk, what we are really trying to communicate here, positive mental health is a matter of training and strengthening brain networks which you want, which are selected by you. And luckily for us, the brain is an excellent trainee, so is the body. Wonderfully, neuroplasticity, or the ability to change mental function and sometimes structure, is possible in all of us, no matter how old we are. And if you enjoy things, if you take on challenges and enjoy it, have more flow experiences, we are led towards change and growth. Yoga is one of the most systematic methods of actually doing this. Of course, there are other methods. It's not that only yoga does it. It could be, fasting. It could be having novel experiences. You could develop an interest in, say, something new, entirely new at the age of 60. You could get involved in reading something which makes you forget yourself. But the basic idea is, please challenge yourself, learn new things, and enjoy it. Do it for the sake of the activity itself and not for just some earthly reward. most importantly, in a crisis situation, focus on yourself and what you can control rather than worrying about things about which you have no control. I would end my brief talk with acknowledging the people who have helped me make this presentation, this research, some of the research at NIMHANS, and I would thank you very much. Maybe I will stop sharing. Of course, the video, I think, okay, where's this? Stop. Okay. Right. So this is what we wanted to talk to you about. I think we are almost 15 minutes away from the end of this session. So maybe now we would open up the session for question and answers or any discussion that the participants may want to have with myself, Hemant, Dr. Gangadhar, who has actually joined us, and maybe Dr. Keshavan as well.
I don't see any questions on the chat, but I had one question to both of you, Hemant and Shivaram, and maybe Gangadhar if he's on the call. And given that we are in this pandemic and the risk for infection is still very much there, and its consequences as people recover. Does steady practice of yoga have any impact on immune function? Is there any data or literature on that? And that would be helpful for people to know.
Do you want to answer that, Hemant?
Yes, sir. Yes, sir. There have been studies, sir, where we have seen that the inflammatory markers are reduced by a sustained practice of yoga. There are studies in patients who have metabolic disorders, patients who have depression. In them, the cytokine markers have reduced. And also, there are studies in cancer patients where it has been observed that the natural killer cell activity and the count both have increased after a sustained practice of yoga for 12 weeks. So in natural killer cell functions and reducing the inflammatory markers, these kind of evidences are there.
In fact, Dr. Hemant and Dr. Nishita are actually involved in starting a study now with COVID patients to look at what yoga does actually, looking at IL-6 natural killer cells, and that hopefully we should have results in a few months. I think there are some questions. What I thought is that we would answer a few of the questions and maybe we can end with the anxiety module that Hemant can demonstrate, because like you said, the second highest I think was anxiety, was it, Hemant, among the answers?
Yes, yes.
Yeah. I think let me take one of the questions here. Well, we thank everybody for the compliments, of course, but one of the questions here was, okay, thinking of people with mental illness, how have you implemented yoga interventions? In fact, this is what Dr. Gangadhar and myself in the team have been doing for the last maybe 14 years. Since 2007, we established the yoga center in NIMHANS, and NIMHANS is a place which primarily deals with the most severely mentally ill people. We get people with schizophrenia, major depression, suicidal patients. And what we have been trying to do actually is to devise yoga modules which help each of these disorders. In fact, we have done that and published that as well. So we have slightly different modules for each disorder. Say, for example, meditation or deep meditation is not really recommended in a patient with schizophrenia. It could actually worsen the situation, both because of dopaminergic activity as well as psychological wise. The person is not in the best frame of mind. You try to meditate, you look into yourself, you don't want to see the things which are happening. Whereas the person with depression, we don't want to be doing very long practices for them. We want dynamic practices. We want them to be activated. we would do more of chest opening kind of asana. So there are a lot of variations we have worked on, and we have found that some of these things actually work. In fact, we recently completed a PhD dissertation on yoga as a sole treatment for depression. Aditi, one of my PhD students, she took around 22 people with depression, only yoga, no medication. And at the end of 3 months, what we found was actually that out of 22, only one person needed to go back on medicine, or rather consult and go for medicine. The remaining 21 improved completely without any medication. And we also looked at what happens in these people at the molecular level, and what we found and confirmed our previous finding that the brain-derived neurotropic factor actually increased. So it's a very interesting finding. We're trying to write it up now. So that's one question that I would take. Are there any other questions? Okay.
Actually, Shivram, I think what they may be wanting to know is how would you motivate psychiatrically ill people to do yoga? One of them would be that, yeah.
It's a little bit of a catch-22 situation actually, because yoga improves motivation, but how do you get people to start doing yoga? Basically, I think the idea is to make it very easy and non-threatening. You look at yoga on the net and you see people holding inverted poses and standing on their head and doing very complex things, and people think, oh, this is not for me, this is for somebody else, and that's not really yoga. So as Hemant demonstrated, a simple 10-minute practice, many of you are psychologists, and maybe it would look very similar to Jacobson's progressive muscular relaxation. Indeed, it shares many of the same basics here. So the first step to say is that yoga is not a very complex phenomenon. All it requires is some degree of mindfulness, and anybody can do it. If we start with that premise, I think we would be able to get patients to do it. In fact, before the new millennium, actually, schizophrenia was nowhere in the picture. As far as yoga was concerned, it was thought that these people could not do it. But rather, on the other hand, we found that actually these are the people who stick to the practice. We haven't been able to publish a single paper with people with anxiety disorders because many of them don't come back. Maybe they get better, but they don't come back. People with schizophrenia come back and they continue the practice, and we are getting very good results. So I think it's an important question that we need to get people into the practice, let them do it at their own pace, no pressure. They must enjoy it, and then it will happen.
Okay, maybe the other observations I had about yoga and psychiatrically, I can come back later on tomorrow. I'm going to be with you all the time in the next session on the Thursday. Yes. Perhaps the anxiety reduction module, or the yoga postures or yoga tips, maybe Hemant should give to the people who are participating.
Do you think that's a good idea, Dr. Keshavan? Should we end with the anxiety module?
I think that's a very good idea, but I also wanted to ask the three of you to give the participants an idea as to what are the new things that you will be teaching on Thursday. So it'll be good to kind of prepare for that. And we could end with a small, 2-minute relaxation exercise.
Yes.
So that would be good.
Yeah, I think Thursday, I think Hemant and Dr. Gangadhar will take us through maybe two major aspects. One is the connection between the mind and the body, and how yoga is able to sort of improve that connection. And as Hemant said, the other two problems which people have pointed out, issues with sleep. How can your sleep get better with yoga? And also what is the fourth module you want to teach them, Hemant?
Sir, depression. Depression, sleep, anxiety, and stress.
Right. So anxiety, he might demonstrate a couple of things today, and in the next one, he would demonstrate what can help sleep and low mood. So this is what we want to do on Thursday. I can see that there are people who did not know that Thursday, there's another one on Thursday. Yes, people can join in. So yeah, Dr. Gangadhar, you want to say anything?
I just also want
No.
to say that one of the questions in the chat box by Jessica said, what can we do to with college students?
Okay.
This kind of an experiential exercise. What I would suggest is anyone who is in contact with college student populations, please feel free to send the invitation. So we would welcome, participants from schools and colleges as much as possible.
In fact, I think Harvard is one of the leaders in that mind-body medicine thing. What I understand, Satbir Khalsa in the Department of, I think, Medicine in Harvard has been doing a lot of work with college students, particularly those who are taking exams, music students. And recently, I think it's almost a mind-body medicine kind of a module is mandatory for medical students at Harvard. So yeah, that's a wonderful thing. So the earlier you start, the better in terms of getting them to do mindful practices.
Yeah. So Hemant, next time, if there is any simple technique for performance anxiety or exam anxiety, it would be good for people to hear about it.
Yes, sir. Yes, sir. So I will just share my slides, sir.
Yes.
Go ahead.
So we can begin by performing this hands in and out breathing. In this, person should sit relaxed, legs together, and should bring the hands together, close the eyes, and then take a deep breath in and open up the arms. As you breathe out, bring the arms together. Now, this is a very simple practice, but the key is synchronization of the body and breath together with the awareness on the breath.
What happened?
Did we lose Hemant?
Okay. Yeah, I think
I see that he's muted. Yeah, now he's back.
Okay. We lost you there, Hemant, for a moment.
Maybe you went into deep meditation.
Yeah, Hemant.
So we're
Can you
almost
speak? Yep. Okay. We lost you there. Yeah. I think the net connection is not very good.
Yeah.
Okay. I don't think we can still hear him, do we?
Yeah, we can't hear him.
We can't hear you, Hemant. No. No, I think the connection is too poor.
Okay, that is fine. So we are at
Don't worry, Hemant. Don't worry.
we are at the end of the session. This was really, really a relaxing as well as informative session, and experiential as well as knowledge based. And we want to thank you all very much for today's session. And we are really looking forward to Thursday. Thank you all very much for the participation, and thank you, Hemant, Gangadhar, and Shivaram. So we'll talk to you on Thursday.
Done. Thursday.
Good
All
night.
right. See you all on Thursday.
Bye.
Have a good day. Thank you.